Some of the most common questions I get surround the topic of exercise when trying to conceive. How much should I exercise? How much is too much? How much is enough? Should I exercise when it comes to doing fertility treatment? Hi, I'm Dr. Shala Salem, and today I'm going to be discussing exercise and how it relates to your fertility. I'm going to be reviewing the top things that you need to understand about exercise and how it impacts your fertility. First, exercise is beneficial for fertility. Regular exercise has been shown to have benefits on both sperm and egg quality, as well as increased success rates in those who are undergoing fertility treatment. Lack of exercise is something that can lead to increased weight, obesity, has been linked to irregular ovulation and infertility. If you are a woman that's struggling with polycystic ovarian syndrome or PCOS, exercise is especially important, like weight training. Weight training is aimed at promoting increased lean muscle mass, and this can be beneficial to help with blood sugar control and reduce chances of insulin resistance, which will help us to regulate our cycles, more likely to have regular menstrual periods, and more likely to have higher conception rates. Number 2, moderate exercise is best. So when it comes to exercise, often I get questions about how much is too much and how much is enough. When in doubt, go for moderate. Examples are biking, fast-paced walking, Zumba or other aerobic classes, swimming, and weight training. I usually recommend to aim for about 150 minutes per week of exercise. That's about 30 minutes, 5 times a week, along with 2 days of strength training. It's best to have movement every day. The more active you are doing moderate activities, it can be beneficial. Studies have shown that women who engage in regular exercise have been shown to achieve pregnancy in a shorter time than women who do not exercise. If you have not started a regular exercise program yet, start slow. Don't jump into it. Start with a few minutes and work up each day. How much is too much exercise? This is another question I get. You might be an avid runner or an avid cyclist. We need to understand how much exercise can impair fertility. Well, it was found that strenuous exercise can lead to irregular or absent menstrual cycles, which will in turn impair fertility. Women who are participating in vigorous exercise like running, like active cycling, and they are doing it for more than 5 to 7 hours per week, are more likely to have compromised fertility. And this is particularly true in women who have low body fat or underweight. A body mass index under 19 is really the critical point where you may have absence of menstrual cycles if you are over-exercising. Try to choose an activity that you can continue throughout pregnancy that will allow you to have a more healthy pregnancy and a healthy postpartum recovery. So one of the things, if you haven't started working out, one of the things I recommend is walking. You can do it anytime, anywhere. Start with walking, move up, and add some resistance training if you can a couple of times a week. Light weights, that is not concerning. It's not going to have an impact on fertility. It's in fact beneficial for pregnancy and fertility. If you want to learn more of my tips on how to help your fertility at home, go to my link in bio where you can download my ebook, which is filled with tips from nutrition to sleep and when to see your doctor.